All right, so your doctor told you that your labs are normal and that everything looks good. But you, on the other hand, you still feel anxious, foggy, depressed, distracted, exhausted every single day. Maybe the medications you're taking aren't working, or perhaps you're experiencing negative side effects without the relieving benefits you were promised. If you're a Black woman dealing with this frustrating cycle, what I'm going to share with you today could finally give you the answers you've been looking for. So, there's a critical gap in how most doctors interpret lab results, specifically for Black women. And missing this key piece of information may keep you suffering while being told everything is normal, even though you know in your heart that that's not even the case. In this video, I'm going to show you exactly what your doctor is overlooking and how to advocate for testing that will actually reveal what's happening within your mind, brain, and your body. So let me start with point number one. Standard lab reference ranges don't account for racial and ethnic differences. This is huge, and here's why it matters so much for your health, our health. Let's use vitamin D, for instance. Vitamin D deficiency is far more common in Black Americans compared to white Americans. Yet, the labs continue to use the same reference ranges for everybody. It doesn't make sense, and let me tell you why. Vitamin D specifically improves immunity, decreases inflammation, and regulates mood, amongst other things. Black Americans have higher rates of autoimmune disorders and disease, inflammation, heart disease, premature onset of preventable disease, and death. So you would think that we will put more respect on vitamin D in general for everybody, vitamin D deficiency, more respect on it as well, and especially as it pertains to Black Americans, right? So let me give you Maya, for example, a 34-year-old software engineer. She visited 3 doctors before coming to see me, complaining of the same symptoms: severe fatigue, difficulty falling asleep, difficulty staying asleep, and mood swings. Every time her labs, especially her vitamin D was checked, it would come back as 30, which is normal on paper. But what her doctors didn't account for was that she was Black. And Black people in general need higher levels of vitamin D to feel optimal, especially due to the differences in how we metabolize vitamin D based on our melanin. So here's the key insight that changed everything for Maya and could possibly change everything for you as well. Optimal is not the same as normal, and you probably already know that by now. Your body may very well need different levels than what's considered standard or normal for you to function at your best. So here's what I'd like for you to do. Always ask your doctor for the actual numbers, not just whether your results are normal. Write those results down and research optimal ranges for you and your specific demographic. This brings me to point number two, and this one is critical for physical and mental health as well. Most doctors only test TSH for thyroid function, but this misses key critical markers that affect your physical and your mental health. Research shows that Black women have higher risk for certain thyroid disorders, especially autoimmune thyroid disease like hyperthyroidism, compared to everybody else. Yet, if your doctor only checks the TSH, they will very well miss important thyroid problems, especially when your symptoms are present and the labs look normal on paper. Consider Layla. Her TSH came back at 4.4, which is normal on paper. But when we finally did a complete thyroid panel on her, we found multiple issues. One of those big issues being autoimmune thyroid disease called hyperthyroidism. So think of it this way. A TSH is like checking your car's gas gauge when your check engine light is on. It tells you one piece of information, but ignores the fact that the check engine light is literally flashing in front of you. So I would recommend asking for a complete thyroid panel, which to me includes a TSH, a free T4, a free T3, reverse T3, and thyroid antibodies. I wouldn't accept we only need TSH as an answer. But thyroid issues are just one of many. Let's get into another one. And this critical issue is one that doctors completely overlook when it comes to Black women's mental and physical health again. Point number 3. Iron deficiency in Black women often hides behind a normal hemoglobin level. So studies show that Black women are able to have, or commonly have, iron deficiency without the anemia. We also have iron deficiency with the anemia, but I'm going to speak to iron deficiency without the anemia, meaning your hemoglobin could look normal, but your iron stores are actually depleted. So picture this. You're running a marathon, but you're doing so on empty, even though your fuel gauge says half full. So that's what happens when iron deficiency exists without anemia. Your hemoglobin may be a 13, which looks fine on paper, but your ferritin may be only at a 10, which will be optimally speaking, I would like that to be closer to 100, at least 75, if appropriate for you, or for my patients, let me say. So here's what most people don't realize. Iron, in and of itself, isn't just about preventing anemia. It's essential to providing oxygen for your entire body, supporting your thyroid function, and making key neurotransmitters like dopamine and serotonin, which directly influence and shape your mood, your motivation, your attention, your mental stability. So low iron stores, which measure ferritin, or which we measure by ferritin, can often undermine your health overall, even if your hemoglobin looks completely normal. So, what I would like for you to do, or what I would recommend, is asking for a complete iron profile, an iron level, ferritin, transfer and saturation, total iron binding capacity, in addition to a standard CBC. I would also advocate for ferritin levels, if appropriate, that are closer to 100 or at least 75. And this again is for optimal mental health and physical health functioning. By the way, if you want to know 10 other critical labs that I find important for my patients as it relates to their mental and their physical health, click the link in the description below. But I'll get more into that at the end of this video. So, point number 4. This is something that affects Black women disproportionately and directly impacts our mental and our physical health. Chronic inflammation, which affects Black women at higher rates. And the thing is, your doctor probably isn't checking for it. Research continues to show that we have high levels of inflammatory markers like H or high sensitivity CRP, ESR, compared to our other racial counterparts. Even after we account for things like income, BMI, and other health factors. So what this could potentially indicate or mean is that persistent distress, by way of, let's say, racism, is showing up directly in our bloodstream. So imagine your mind, your brain, and your body trying to function while constantly fighting off a persistent fire. That fire, in this case, is called chronic inflammation. Chronic inflammation hijacks your brain's ability, your body's ability, your overall ability to achieve optimal health, leaving you to experience the negative consequences of inflammation, persistent inflammation at that, like premature onset of preventable disease and death. So, depression and anxiety specifically, they're not always chemical imbalances in your brain. Sometimes they're the direct result of your brain trying to fight off inflammation throughout your body. So I would recommend requesting inflammatory markers to include high sensitivity CRP, ESR, and homocysteine. In addition, I would actually ask about food sensitivity testing, since hidden food reactions can often drive chronic persistent inflammation. Quick question, because we're speaking about food, I want you to think about right quick foods that you've eaten, things that you have drank before in the past, and just kind of see if you can associate the food or the drink with any negative physical or mental health changes or symptoms. I just want to see if you can start putting those connections together, if any connections are fitting for you. All right, so now on to point number 5. This is crucial because knowing what to test is only half the battle. You need to know how to get your doctor to listen, order the tests, and interpret them appropriately. And unfortunately, this can be a big ask these days, but at least we can start getting your doctor to listen. So I want you to think about walking into your next doctor's appointment prepared like a lawyer that's going to present a case to the judge and the jury. You have your symptoms documented, your family history ready, medications or things you've tried, and specific tests that you're thinking about, and you have that all written down. So this approach is what transforms you from a passive, codependent, and dependent patient within the healthcare system into an empowered resource and director of your own health and your own life. So here's exactly what I need you to do. We're going to use a framework that medical practitioners are trained on when we're in school. And this is what we use in real life, in practice. It's called old CART, or old CARTS with an S. So I want you to create a symptom timeline before your appointment. You're going to write down when the symptoms started. That's the O, onset. You're going to write down where you're experiencing the symptoms. That's the L, location. How long you've been experiencing the symptoms. That's the D, duration. How you would describe those symptoms. That's the C, characteristics. What makes those symptoms worse? That's the A, aggravating factors. And what makes those symptoms better or offers relief. Those are the relieving factors, or the R. You want to write down also, when do these symptoms occur? That's the T, timing. And lastly, how do these symptoms impact your daily activities and your quality of life overall? That's the S, severity. This documentation is actually what makes it harder for doctors to dismiss your concerns, because you're giving them everything that we're supposed to be evaluating and investigating anyways. All right. In addition, if you want, and if you're curious about these things, I would recommend using this exact phrase. I like to rule out nutritional deficiencies as a cause of my symptoms. Can we run a comprehensive nutrient panel, including the tests I have listed here, and then just pass them over the list that you have written down? Remember this. We're supposed to be the experts in medicine and psychiatry, but you are the expert in your mind, in your body, and in your brain. Trust your instincts and don't accept dismissive answers, even though I know it can be difficult. Again, trust your instincts, and never accept dismissive answers. Healthcare, like any healthy relationship, should be interdependent, not an unhealthy, toxic, codependent, or dependent relationship. All right? So I want you to note that the traditional healthcare system overall is built to detect disease and treat disease. It's good at that. And it's also insurance driven, meaning the healthcare system overall is built to find disease, treat disease, get patients in, get patients out, and see as many patients as possible. So if you continue to operate within that traditional healthcare system, you need to know that this is just the nature of the beast, and you're going to have to learn to effectively navigate within it. Like schedule an appointment to discuss one topic at a time, as to not overwhelm yourself and as to not overwhelm your practitioner. In addition, I want you to also know that you can always choose to opt out of that system and opt into personalized healthcare, like Maya and Layla chose to do. So, if you're ready to be the empowered resource and director of your health and your life, I've created a guide called the 10 Critical Labs Most Doctors Don't Check for Black Women and Why They Matter. This checklist includes those 10 labs that I find critical for Black women's mental and physical health, why they matter, and a script for talking to your doctor. Click the link in the description below, complete the form, download and read the guide right now, and finally get insight into what your mind, your brain, and your body have been trying to tell you all along. So, lastly, before I go, I'd like to know, actually, which one of these points surprised you or even resonated with you the most. Let me know your answer in the comments below. And of course, don't forget to like, subscribe, follow, hit the notification bell so you never miss videos that are meant to support you on your journey to Afia. Afia, which means health, the state of being free from and of physical or psychological disease, illness, or malfunction, and wholeness of mind, body, and spirit. Remember, your health journey isn't supposed to be a mystery. Get answers, be your best self, and connect with healthcare providers who listen to you and take your concerns seriously. All right, bye.